Why is it so important to hear from the families? Well, they're instrumental in healing wounds. Although I'm a major player in helping families juggle their loved one who's homebound or bedbound and dealing with their wounds, the family member are the ultimate team players. I'm the conductor or the coach. I'm really guiding them how to heal the wounds. The next patient you're going to see is an interview of the daughter who's managing her mother, who's 102 years old now. When I first started seeing her, she was 99 and had an infected pressure ulcer. You have seen a previous video in terms of the treatment and my introduction. This is to show how instrumental the family's been. They've adhered to my 4 Ps, which are prayers, plenty of love, pressure relief, and protein. Please hear from the daughter. And this is something that you can do. You can really do this and keep your loved one home to thrive and to have a quality of life. Stay tuned for the interview. Make sure you subscribe to the channel, and I look forward to any comments or suggestions. Thank you. Okay, my dear, tell me a little bit about your mom, what's been going on the past few years, health-wise, personally, everything.
Okay. I was doing pretty well for the ball before COVID. But she had a heart attack and she had to go in the hospital. And she was going to Mount Sinai to a heart specialist. And COVID came. During COVID, she had a swell. And of course, that changed a lot of things because I honestly didn't want her to go to the nursing home or to the hospital. So we handled it as best we could. She, some way, got a sore, on her, what they call right there in the back, a hip bone.
Let's take them.
Okay. And I was trying to treat it. At that time, we didn't really have a doctor. So I was just trying to treat it the best that I could. And it seems as though it's appreciated. But then I said, well, maybe we should have someone look at it. And we got a in-between doctor. And I don't know. And whatever he prescribed for it, it just full blue, just went out of control, could sleep. And we were very upset about that. And then we heard about a doctor, Bienstock. Oh, and God brought him into our life. Oh, just amazing. As he said, Mommy, like, he really did. He very compassionate, unwavering in his care. You called that the Bienstock for anything within minutes. He's returning your call, telling you what to do, how to do it. I'm telling you, his beginning when we first was dealing with this, it was, we didn't think she would survive it. It was overwhelming. But tender loving care, compassion, I would say like care. Mommy survived it. Now we're still, she's bed down now, but she's come so far. She really had. Being a caregiver is very challenging, and sometimes it's very hard. It is also very rewarding. Oh, she's come such a long way, and my main focus with my mother again that she's still with us, that her dignity no way. I still want her to live in dignity and love, sharing. I tried to be the type of person my mother is, but she's only been a person in love, comfort. She, two masters. She, a phenomenal mother, wife, friend, and then well, is there anything else you'd like to know reference to?
So tell us about the wound, what's been going on with the wound, in your words, like it scores out, in more detail. You gave us a background that it started in the hospital.
Wound started. It was started small, and we were dressing it with get this kid medication, but it seems to be getting better. But once this doctor came back, how I can't even say, but whatever he put on, whatever he gave us, because he said, no problem, it's going to be so much better. But it just be out bushy. It was like as large as cantaloupe. Yeah, I would say. And never thinking that it would. I mean, that happened over time. Never thinking that it would it took place to this now. I could even visualize the skin coming back to get back up thick, warm, neat. But he did all little everything that Dr. Bienstock told us. We treated it with different appointments. We dressed it twice a day. It started to. I would look forward to not coming every time because I was so bright that I was doing something. But every time he could come, he said, "Oh, there's so much there. Oh, I'm really good." And it did come back very not small, not very small, but it was all skin was drawing back. And then she had a setback because it opened up again. You did not expect that erection to happen. So we started all over again. I think that's when we started with all the AKI installation, and we were really very scared at that time. But in doing what we reached out to do, eventually this started to clear out, and it started to get smaller and smaller. So he used different ointments, different patches, like the was that patch is just for that ulcer. But in using all the different medications that we started to use, eventually it starts to get smaller, and now it about was like this, and now it's like this. I would say, so I think that's the flag of the sky. What we did to get my fish.
What do you think the recipe was for success with your mom?
Well, I have to say, first of all, it's the expertise of the doctor, and then
how to say small reconstructions, comfort, courage that we were given to continue, on our journey, and it would get better. Also, help. Oh, my son was I don't know what it was done with that. His help as well. Because it's very hard when you have a bedbound mother, a bedbound relative, whatever, and trying to do it by yourself. You need support. You really need support. So I think also would be support of my son and my niece, and also the kid that was getting love. So I think that had a lot. There are recovery issues.
What else do you think the family helped you with, and what other things can you think of that really made a big difference?
And family, the only thing I can say is the support. More than anything, support, love, healing here. The compassion, the concern that they had for us. And of course, you can't do anything without God's grace. At God's mercy, nothing was so perfect. I'm so grateful. So grateful, Mike. I can't thank you enough. So they kind son. Being good mom that night, she and I know without God's grace, I don't know how we would have made it. Called out to God many just for a blessing or a change, a strength, courage. So, of course, God is so good at that. So grateful about believing and trusting. And
If we could go back in time, what would you want it to do?
If I could go back, I would have tried to get help. Maybe early. That is my biggest. As my biggest regret. I wish that I had. Then maybe she would have to go through all the children in my head. Yes. They got to go. But it did try. But it wasn't the right one. So I had to wait until the right wicked in my life. And now stops. It's just the truth. That's in the and that's in my heart.
Thank you for sharing that. Now, if other families, had, mother, father, son, aunt, uncle that, became bedbound or had issues with home care, what would you tell them to do? Like, if it doesn't have to do with a wound, but what would you tell people that have, a mother or father that's, becoming more challenging in terms of, medical issues?
Oh, gosh. I tell you one thing. You have to have a lot of patience. You really have to when it starts because it's something you don't know how to deal with a lot of times, and you get frustrated, you get I'm sad. But if you seek help, you gotta seek help for yourself.
And well, see healthy mom. You accept a lot of times you don't accept
Help, and we should. And to make sure that we know a lot of times we put things off, and we should do what we can as soon as we can. So that was my biggest regret, and I would tell anyone that has a mother or a loved one, and they're going through this it's a lot. It's a lot to go through.
you love, especially your mother. You see her. You lost sometimes. But I can tell you, when you're with her and you have those moments, and we've had those moments where you're telling her you love her, you're grateful for her, you thank her, and she was back to you and she loves you too.
It's hot, but because you know that she's getting it, or she is still there. You know that feeling is still there, no matter what. So beautiful. So
that's what I put back in whatever are experiencing this, so we're going through it. It takes a lot of volunteer, passion, concern, and
patience, understanding all.
That's great. Is there anything else you want to speak about?
No, the one thing that I would like to say, I read something about a good doctor. She's decent. A great doctor. No. Yeah, a good doctor treats decent.
great. No, I'm sorry. Good doctor treats the disease, but a great doctor treats the patient with the disease. That because that's honest.
He personifies that. He never lets you down. We call you back as soon as you fall in. And I would also like to say how grateful I am. My mom is going to be 103 in 4 months. And that's this basic is. I'm so grateful that God allowed me to be the one secure. And I love that. Peace off. And I'm peace.